my name is Robin Roten, and I would like to thank you all for being here today for my presentation of my nursing capstone project change proposal, bedside patient handoff. I have been a nurse for 20 years, the last 10 of which have been at Roper Hospital in the CVICU. Before I begin my presentation, I would like to begin with a few questions. Do you feel like you get all of the knowledge and information that you need during patient handoff? Have you ever come in at the beginning of your shift to find an IV drip rate infusing at the wrong rate or the pump misprogrammed? Do you always go in with the nurse you are giving report to look at IV sites and wounds and sheath sites? Do you use an S-bar when giving report? What methods do you think would help change report to make it more effective? Shift report has historically occurred in many different ways, ranging from a tape-recorded report to a verbal report at the nurse's station. However, these reports can be lengthy, they can be incomplete, causing you to miss vital patient information. In addition, the patient and the family are often not included in these types of reports. Nationwide, many hospitals are adopting a more patient-centered model for the transition of care. One such model that is quickly gaining ground is the bedside shift report. This standardized method of nurse-to-nurse shift report takes place at the patient's bedside versus the nurse's station. This strategy of the patient-centered shift report is to help assist and aid in the safe transition of information related to the patient while involving the patient and his or her family members. Benefits of patient-centered shift report include enhanced accuracy of the report, visualization of the patient, which could promote the prioritization of care, and it engages the patient in his or her care. Bedside reporting encourages the patient to participate in their care, which ultimately increases patient satisfaction, enhances nursing collaboration, and accountability. The end result is improved, effective communication among care providers. Including patients in their care helps them to recover more quickly. They are more satisfied with their care that they receive, and they are more likely to adhere to the prescribed care plan that is intended for them. The Joint Commission has identified nursing report miscommunication as a causative factor in 80% of medical errors. Bedside report allows the oncoming nurse to ensure that bed alarms are set, patient monitors are within parameters, and to inspect the overall health and status of the patient. Implementation of bedside shift report can also eliminate nurse-on-nurse conflict with the nurses having issues with the prior nurse's work performance. Roper Hospital introduced bedside shift report 2 years ago. Some units embraced it, while others embraced it only temporarily before reverting back to their prior practices, while CVICU never really became engaged in the process at all. However, due to an uptick in incident reports and a drop in patient satisfaction scores, it was identified as a need to reevaluate the current processes that we have in place. In order to introduce this change project into the unit, I will first conduct a survey to assess the current opinions that the nurses have on reports. The focus of the analysis will be to give insight to the report, and then to utilize this information to develop an education program that will help the nurses understand the purpose of bedside shift reports a little better. We want to address those negative perceptions right off the bat. An S-bar will be developed to help streamline the reporting process. Nurses need to understand that sensitive patient information can still be discussed outside of the room. CVICU currently has open visiting hours, and many can view this as a HIPAA violation when giving important sensitive patient information in front of family members. Therefore, we will develop a script that will allow the nurse to tell the patient that shift report is about to occur and ask if they would rather have their family members step out or stay in, and to also address with the family that the nurses will be exchanging vital patient information and that they need to hold their questions and comments to the end so that nothing is overlooked. Whiteboards are currently in place in every patient room. This will be enforced to update these patient whiteboards so that the patient will be aware of vital information such as the time of their last pain medication and what their current goals are for the day. The patient care technicians will be educated to round on the patients an hour before shift change in order to avoid any last-minute interruptions. Weekly rounds will be conducted within the staff, reassessing what their viewpoints of the patient-centered shift report is and address any concerns that they may have. Nursing leadership within the unit will be asked to hold staff members accountable when they witness them reverting back to their old ways. We will also designate shift report champions that will also encourage their co-workers to adhere to the new processes. At the end of the implementation period, a second survey will be passed out to evaluate the nurses' current experiences and viewpoints on bedside shift reporting. The desired outcome of this project is to see an increase in the number of nurses responding that they do now participate in bedside shift reports. Another goal would be improved nursing satisfaction in the report process, as evidenced by nurses stating that they are now receiving all of the necessary information during handoff. Other positive effects of utilizing bedside shift report would be a reduction in errors, as evidenced by nurses reporting less misprogrammed IV pumps and drip rates. In addition to more respondents saying that they look at wounds and IV sites with the ongoing or offgoing RN. I know that change is hard, but remember that you do have a voice. Bedside shift report has been proven to be the best practice, and it has numerous advantages for both the patient and the nurse. Effective communication and providing pertinent information to each other ensures patient safety throughout their stay. That's it.